Is cracking your knuckles bad for you?
Many people wonder if cracking your knuckles can harm your joints or lead to long-term problems. In this video, we'll answer the most common questions about knuckle cracking and what medical research really shows. Let's clear up the myths and facts to help you understand if this habit is actually dangerous.
Does knuckle cracking cause arthritis?
One of the most widespread beliefs is that cracking your knuckles leads to arthritis. Multiple medical studies, however, have found no direct link between cracking your knuckles and developing arthritis. Arthritis is usually caused by factors like age, genetics, and injuries, not by joint cracking.
What happens when you crack your knuckles?
The sound you hear when you crack your knuckles comes from gas bubbles rapidly forming and popping in the fluid around your joints. This process is called cavitation and does not damage the bones or cartilage. The popping sound is harmless for most people and is not a sign of injury.
Are there any risks or downsides?
For most people, occasional knuckle cracking does not cause harm. Some studies suggest that frequent knuckle cracking may be linked to mild hand swelling or reduced grip strength. However, these effects are minor and rare. If you feel pain, swelling, or discomfort when cracking your knuckles, it's wise to consult a doctor.
When should you be concerned?
If knuckle cracking is accompanied by pain, swelling, or changes in joint movement, these could be signs of an underlying joint problem. Otherwise, the habit is generally considered safe. If you have concerns or notice changes in your hands, seeking guidance from a medical professional is recommended.
The bottom line, safe or not?
Cracking your knuckles does not cause arthritis or serious health problems for most people. The habit is largely harmless, though it may annoy others. As long as there is no pain or discomfort, occasional knuckle cracking is considered safe from a medical perspective.